I'm Carol Hodgson. I'm an Associate Professor at the Intensive Care Research Centre. So the full name is the Australia and New Zealand Intensive Care Research Centre. I lead large randomised controlled trials across Australia and New Zealand in intensive care. So we're trying to improve patient outcomes. So my background is I'm an ICU physiotherapist, so I worked as a clinical physiotherapist for nearly 20 years, and then I decided when my children were very young to do a PhD. So on completing my PhD, which was in a topic around mechanical ventilation, I came to work here at Monash University in the Intensive Care Research Centre, and we immediately won a large grant for a multi-centre trial on open lung ventilation, which is where patients are using a mechanical ventilator, so artificial ventilation, and we apply positive pressure to the lungs to try and hold them open in acute respiratory distress. So I wasn't the lead investigator. I was the lead investigator on all the projects through my PhD, which led to the grant application, but I wasn't the lead investigator on the grant application. But actually the lead investigator sits half of his time in Ireland. So Alistair and I now co-lead the study. It's a big international trial. It's run across Australia, New Zealand, Italy, Saudi Arabia, the United Kingdom, and it's been a really fantastic learning process for me. And since then, we've gone on and won several more large grants. One of the ones that I'm leading, and I was CIA, so first chief investigator on the grant, with the National Health and Medical Research Council, is in early mobilisation in ICU. So looking at getting patients up and moving, so preventing muscle wasting and weakness during the critical illness, trying to get people moving more. And you can imagine with a physio background that's something that I'm very excited about. So that study was funded last year and we're about to start. And it's also going to be an international study. So we have approximately 30 sites across Australia and New Zealand, and 3 sites in Germany, and a site in Ireland, and potentially some sites in the UK. So again, these are large clinical trials that we believe will change practice. And whether the results are negative or positive, we will know categorically at the end of these large phase 3 trials whether early mobilisation and open lung ventilation actually improve patient outcomes or not. And it really will mean that will inform our clinical practice moving forward, which is, I think, what's important to me, is that the research that we're doing is all about informing our clinical practice to improve the patient's outcomes. So our critically ill patients at some point should benefit from the studies that we're leading. Recruitment of patients into studies in the intensive care unit is very challenging because the patients are obviously critically ill. They're usually on artificial ventilation and mechanical ventilation, so we can't seek consent from the patients themselves at the time that they're randomised into studies. So that means that at a time of extreme distress, we're approaching the families and the next of kin or the person responsible for the patient to ask for their consent to include their loved one in a study. It's a real skill to be able to do that sensitively and humanely, and expressing how important we think it is that we actually ask these questions while patients are so unwell. So the way that we would usually word it to a patient's relative is that we would say, usually our studies are studies of comparative effectiveness. That means that depending on where the patient was located, they might get one technique or another. So for example, with our open lung ventilation study, they might get the open lung ventilation strategy, but lots of doctors would also use a conventional strategy. So we're comparing it to standard care almost all the time. So we would say to the families, look, we understand that your daughter, son, husband, wife is critically ill, and the way that we operate the mechanical ventilator may be with some of the medical staff using a strategy where we do an open lung strategy, which includes such and such, or with another medical staff, it may be used more conventionally, which would be blah, blah. And we don't know which is better. And we honestly are unclear which way is better, but we think that it's important that we find out. And so we would like to ask your permission to randomise, and we would then explain any risks or potential benefits and allow them to ask any questions. And every time we ask a relative, we emphasise that you know, this will in no way impact on their care in the intensive care unit, and that it makes no difference if they say yes or no to us. It's completely up to them whether they agree to participate in the study or not, and that won't impact on the patient's care. That they're already in a centre of excellence, but we are a large teaching and research hospital, and therefore we promote research to inform best practice. So getting the job at the Intensive Care Research Centre was definitely a career highlight. So I knew that I wanted to work at the research centre from the minute I first attended the first clinical trials group meeting. So we have an Australia and New Zealand Intensive Care Society clinical trials group that runs all of our large multi-centre clinical trials. So until I had, right up until the point of the end of my PhD, I had been involved in research for many, many years, but always at a single study centre or perhaps two centres, no more than that. And of course, I was introduced to the trials group that run these amazing, large, multi-centre studies binationally. And I was so excited that I might be able to be involved in something like that. And I approached Professor Jamie Cooper, the director of our unit, and I said to him, oh, look, I know that you've got a research fellow position and I've finished my PhD. I'm going to put in an application. But I have 4 young children and I really only want to do it half time. And he said, don't bother. We're only looking for full-time candidates. And I said to him, you know, Jamie, I'm going to put in my application anyway. And I understand that I can't get the job because you're only looking for full-time, but I want you to interview me and just hear what I have to say, and you know, eventually there may be a part-time role that's available, and you'll remember, you know, what I have to offer. And I went to the interview, and at the end of it, Ronaldo and Jamie offered me the job and said, we're going to give it to you half-time over 2 years. We'd love you to come on board. And I've subsequently become the deputy director of the department. And I just think sometimes you just have to put your hand up and have a go. If you really believe passionately that you want to do something, you just have a go, and don't worry about people telling you that you can't do it or that opportunity isn't for you. I think you just, you know, give yourself every opportunity to be considered for the role or to be considered for the next role.